If you're enjoying this documentary series, please consider supporting the channel by becoming a member. Establishing a clinic for the village of Todorova is an important humanitarian effort that the medical team can be proud of. However, they also have a first-rate field deployable hospital, the ASC, or Advanced Surgical Center, in Ćoralići. A much appreciated medical asset in theater, the primary role is to support the various members within the NATO element in the region. Without doubt, the Canadian Forces Medical Branch prides itself in their ability to provide excellent medical care for military members and civilians when necessary.
It's big enough to carry 4 patients.
Well, first of all, this is the Bison, right?
Bison ambulance, yeah. 8-wheeled, travels pretty fast, about 110 kilometers an hour. If we need to. I could carry 4 patients lying down or 6 sitting. Oxygen capacity for 4 patients. Basically, we have every kind of trauma tool we need for any kind of call that comes up.
The hospital starts in these 2 sections of canvas here. We haven't had to use them so far, but if we had a lot of casualties coming in, this would be their first stop, and they'd be triaged in this area right here. And we keep ambulance resupply stores right there, so if we were in a situation where ambulances were coming and going, they would stock up in this area as well. This is the recess area. This is kind of comparable to a hospital emergency ward. So there's 2 stretcher bays here. This is
Yes, please.
So this is the patient's first stop when they come into the hospital. And there'd be a recess team around each stretcher there. And you can see that they've got all their equipment either on either side or clustered around each stretcher. And over on the other side, this is the ICU, and they're set up here for intensive care patients and also for post-anesthesia recovery. So when they come out of the operating room, this is where they come until they're under the anesthetic and they're ready for the ward.
We can handle just about anything here that a normal ICU could. Ventilated patients, the whole 9 yards. If you'll notice the lights up on the ceiling, we've got 2 separate sets of lights. These ones which are our field lights and those ones which are the normal ones that come in these trailers. They run off of the 2 different electrical systems, so if one generator goes down, the other one is still able to function and we're still able to have lights and electricity, so we've sort of got both systems working all throughout the hospital.
Yeah. These are our refrigerators,
which are quite different looking than a usual refrigerator. They're very rugged and field portable refrigerators, and this has got blood in it. Blood supplies to be used in here and to be used in the OR during a case. Don't bother with your shoes.
Okay.
We're going to do the floor again anyway.
Normally you can't come in without shoe covers, but she's going to wash the floor anyhow.
I'm going to do the floor anyway, so come on in. Everything's covered in plastic in here because we are in the field, and this is all quite specialized equipment. We don't want anything to get too much dirt in the works. This is probably the cleanest area of the hospital. This is the operating room, and it's comparable to an operating room that you'd find in any city hospital. We can do just about any kind of surgery you can think of in here. It's kind of hard to see. Everything is covered in lights in plastic bags right now. We've got one ceiling-mounted light and another one that can come in. So you've got 2 lights, surgical lights. Once again, as I mentioned out there, we've got the 220 power and the 110 power, so that we've got lighting in here no matter what happens to either one of our generators. Up at the top is the anesthesia end, and that would be all of his anesthetic equipment. Patients go to sleep here just like they would in any other hospital, using a combination of drugs and gases. Our gases are all kept in tanks. That's an oxygen tank up there. Cautery, a tourniquet, high pressure infuser for someone if someone's lost a lot of blood and you want to pump it in very quickly, as it would in a mass trauma case. And it's a level 1 infuser. Heats everything so that you're not going to get a shock from running cold fluids into a patient. And it can pump in liters per minute if you've lost tons of blood. Several suctions all throughout, same as you would in any other. Air conditioning, which is extremely nice right now. Heating as well when it's cold here. All of our supplies are kept in these cabinets, and everything in here is field portable. This summer on Exercise Venom Strike in Gagetown, we were out moving the hospital around to make sure it was portable if it had to be for any deployment. And everything is very nicely field portable. So these just get covers on them. They actually look very much like big speakers that you'd see taken to a rock concert. And you just pick them up and load them on a truck and move them away. And all of our sterile supplies are kept in here, wrapped as they would be in any other civilian hospital. All of our preparation for OR is done out in this area, which we call CSS. It's kind of small and cramped, but it serves the purpose. We actually have hot and cold running water in this setup, which is extremely nice. We've got a preparation area where all of our trays are cleaned and processed, a small sterilizer here, and then we've got capacity out back to put 2 large field sterilizers. And that is roughly the equivalent of a sterilizer that would be in a large city hospital. It can run, it's under any kind of field conditions. Even if we don't have electricity, we can run that using a propane stove. And all of our bulk sterile supplies are kept out here. So our basic load that we carry is to be able to do 30 operations sort of without any sort of resupply whatsoever. After that, then we want to go talk to the pharmacy, because the pharmacy that we have with us carries a lot more supplies than we would. But at roughly 30 cases without resupply. We have the whole surgical team here, which is an anesthetist surgeon, 2 OR nurses, and 2 OR techs. If we had a complete team, we'd have 2 surgeons and 2 techs, 2 surgeons and 2 anesthetists, and then we could run 24/7. We're not that busy here, we don't need them. So, 1 is enough. 1 of each is enough. Yeah. Last part over here is the ward.
We won't go right in because there's a patient in there right now. Okay. But that's where the patients stay, and we've not been too busy, fortunately.
I've got 8 beds in there, and there's another section of canvas set up out back with some other beds, so they could actually expand to probably about 20 beds if they had to. Right now we've been very quiet, and so we're lucky. If we expanded to 20 beds, obviously the sicker ones would be kept in here, and the less ill ones would be out under the canvas.
And through here we have our X-ray department. Yeah, I'm currently by lab tech.
I'm a lab tech and I'm an X-ray. Why am I here?
The X-ray department is probably one of the less portable sections of the hospital.
But it did, however, move all summer with us. So.
But they've got it all set up. They built themselves darkroom right behind me here, so that they can process their films in there. Okay, this is the X-ray department. And they're pretty well set up. They've built themselves a darkroom right here. It was one of the first things that they did when they were setting up. And they've had some problems with the water here. It's very hard water, which is very hard on the machinery. So the pharmacy has been keeping them supplied with sterile water in bags, which has been a bit of a problem for us, but it's kept running. And they haven't been too busy, although the checks are coming in quite often with patients for them to X-ray. And if we go out through the main door again, the lab was not precisely an afterthought, but they have so much equipment that they ended up not being able to fit nicely into the hospital. So we got an extra ISO, and now they're set up right here, just outside the hospital. And the light's not working. Oh, there it is. Yeah, there it is. So you can see that they're extremely well equipped here. And they're doing lab tests here for the other Canadian camps as well. And Rob, come on in. No, really, I want you to explain your lab.
All we can say is they've got a bunch of machines that go ping. Rob, purple worthy, come and tell us about your lab.
All right, you're now inside the laboratory here at the ASC in Ćoralići. It's one of the hot spots of the area. We get a lot of work in here. It's a little quiet today. but normally we're just bustling in here. We've got all the capability here that we would normally have back in good old Canada. We've got chemistry, we've got hematology, we've got all kinds of serological tests, and we've got lots of blood. So if we have some problems, then we can patch them up in the OR and pack them full of blood and send them home. And that's basically what we do here in the lab. Thank you very much.
Already asked the patient, he doesn't mind.
Go for it.
This is the dental truck, and this is kind of neat because it's a whole dental clinic mounted on the back of an MLVW. And Sergeant Wilson is up there right now doing a repair. The patient says he doesn't mind if you take a look at him, so just careful on the stairs. It's extremely portable since it's all mounted on the back of the truck. When they're going somewhere, all they do is tie down all the loose bits and off they go. So this is their entire clinic, and it's about as well equipped as it would be in a dental office back in Canada. Now, the dental people have been extremely busy, not only with Canadian soldiers, but also with Czechs and British, and they've done a lot of work on the locals as well.
Correct.
Yeah, and they've been in very high demand. Dental care in Bosnia in the last several years has been largely ignored. So whenever the translators, the kitchen workers find out that this kind of care is available, then the dental people are usually swamped. So they're very popular. We've done roughly 30-odd cases on in our own OR here. Most of it's been minor stuff, but we've also taken out appendixes and fixed bowels and taken care of a gunshot wound and that sort of thing that you'd expect to do in an OR. But the vast majority of our work has actually been on a humanitarian basis down in the hospital in Behatch. At least a couple of times a week, sometimes even more than that, we've sent a surgical team down to the hospital in Behatch and have been working, trying to help the staff there catch up on a backload of patients that they've got that have, it's a lot of it is elective surgery, but it's stuff that's been sort of piling up since the war started, and it's things that they haven't gotten around to because of course they've been more busy with war trauma. The biggest thing that we've been doing in conjunction with some of the non-governmental organizations, specifically a Dutch surgeon with the Red Cross and a plastic surgery team from Medicos del Mundo in Spain, is reconstructive work. And that's reconstruction of nerves and tendons and hands so that they're usable again, and reconstruction of stumps from amputations. During the war they did mostly just what we call as a guillotine amputation, where they just sort of chop everything off, save your life, and that's it, and let it heal. And a stump like that on a leg is not able to weight bear. So what you do is you go back in, you shorten the bone a little bit and make a muscle flap over the bone, and then skin over that again, so that it is actually strong enough that it can support weight without any problem. That's what we call a stump revision. Then afterwards they can be fitted for a prosthetic device, and Handicap International is working at that hospital as well, working to fit stumps on all these patients. And there's a backlog of a couple of hundred just in the Behatch area alone that need stump revision. So we've been helping in that front as well.
Wow, that's quite a bit. So a lot of your patients down in the Behatch area are primarily civilians?
They're all civilians.
They're all civilians.
A lot of them are, we've worked on some children as well, women, young men. We can assume that some of those young men were also soldiers during the war. What they're doing now is another question. It's quite something else when you see quite a number of very young men who are now missing a leg or two, and their lives are completely changed. So if we can do something to help make them a little bit more productive again by being able to be fitted with this prosthetic device so that they can actually get around, then that makes us feel good anyway.
That's terrific. What do you see the future for the CCIFOR medic unit here on the base?
For us right now, well, we're getting to the end of our tour right now. We'll all be going home, rotating home in July. If things keep the way they are, and they should by everything that we've seen,
this hospital will stay pretty quiet as it has throughout our tour. We've done very little in the way of care on our soldiers other than routine things, and I would say the majority of our injuries we've seen have been sports related, that kind of thing here. As for our work down in the Behatch Hospital, they'll be closing in July. For the month of July for emergencies only, so that their staff can have a bit of a break and a summer holiday, which is something they haven't done in a long time. And they'll just be keeping a sort of an emergency basis staff for emergencies and no elective surgery whatsoever for July. But I would assume that our replacements who are coming in July will probably carry on the same sort of thing down in the Behatch Hospital when we're gone.
Terrific. So they'll be taking care of a lot of civilians, you feel?
Probably. I would assume that they'll want to carry on. It'll depend on the surgeon and the anaesthetists that are part of the team. But if you look at the experience of the past few years over here, the surgeons and the anaesthetists have all wanted to get downtown, and for two reasons really: to help the civilians, and it also keeps your practice up. If you sit here and do nothing for 6 months, you begin to lose your touch. So it's good practice for us. You keep your skills up. If you don't use it, you lose it.
With professionalism, the occasional sense of humor, and an understanding of the challenging job they potentially need to do should the mission become truly serious, the medics have responded with a well-planned solution. I'm getting a much better understanding of the responsibility our Canadian Forces members have in theatre. But this is merely one component of the complex, multifaceted mission.